Hey everyone, and welcome back to The Advisor. My name is Lisa Urbanski, co-host of the show, joined today by Dr. Demian, and I just absolutely love this man so much. He is so genuine and he leads with his heart, and totally need more people like him in the world. Such a light. He's a visionary in modern medicine, and he's now become obsessed with this world of anti-aging. I mean, who is not obsessed? Who wants to age? So today we're going to break down, as promised, peptides. We're going to talk about peptides the whole time, and he's really going to illustrate for us the power in them. Thank you to Spreaker and iHeartRadio for your sponsorship. And to our fans, to our listeners, and people watching, please do not forget to like and subscribe. It's so good to see you again. You were sick, you're back, you have a voice, and I'm so glad because you have a lot to tell.
Thanks a lot, Lisa. I really appreciate it. I really enjoy our conversation. You're such a genuine person that's truly looking out for people, fans, and patients as well. And we share this closely. Both of us trying to make a difference, even if it's a small difference, by debunking a myth or giving accurate information away from all the hype. So I really appreciate our conversation. Thanks a lot for having me.
Oh my gosh, you're so welcome. Yes, we debunked a ton of them. The last 2 episodes, we went through a whole bunch of things: red light therapy, cold plunges, methylation. What else did we talk about? We talked about mushrooms, a whole bunch of stuff.
Yeah.
Yes, all the things. And yeah, that was a lot of fun. So to our listeners, go back and listen to those because you'll learn a lot from them. And do not stay in your cold plunge for longer than 3 minutes.
That's right. We're going to freeze to death.
You're going to freeze to death. Oh my God. So you are now obsessed with this world of anti-aging. And you brought up peptides, and you were like a little kid. You just became alive and you were so excited. So let's talk about them. Why are you excited about it, and what are they?
I'm not only excited about them, Lisa, I am super obsessed with them for a reason. I'm going to mention the reason. It's not only this, and every new peptide comes to the market, I'm like a kid in a candy store. And that mainly started probably like 6 years ago when I started getting in my mid 40s. Still not going to tell anybody my age, but whatever. So anyway, and
you look great. You look so young.
So, and I started feeling it at the gym. I was taking pre-workout, post-workout, glutamine, creatine, all the good stuff that's been studied forever, and I'm not recovering properly. I work out a large muscle or a small muscle. It takes weeks to recover. Hindered my gain, start losing muscle mass, although I was going to the gym 6 times a week, every time for 2 hours.
Wow.
And I'm still missing something. Then one day I had a cut. I cut myself with a knife, and it took over 3 weeks to recover, to heal. So I thought, what is going on? Looked at my skin, starts to thin out. I said, okay, I'm not going to accept that. And nobody should, Lisa, accept that, because we're going to get into most of the studies now. And I said, okay, what can I do? So I looked into what could be done, and I looked into growth hormones. Growth hormone, there are a lot of studies. It's not legal in some countries, like it's not legal to have it for longevity in Canada or whatever. In the US, it's barely legal, but people, and a lot of my patients used to go get it from Mexico. So anyway, I was able to get my hand on some legitimate growth hormone. I tried it, couldn't tolerate the side effects. It is a fountain of youth. Had the best sleep ever the first few nights, but the nerve pain and the carpal tunnel in my hands, I couldn't sleep for days. So I stopped that after a few weeks, right? I know a lot of clinics, longevity clinics in the US, in the Caribbean use it, but I couldn't. and the side effects are really major. So I looked at what is next. And I found peptides. Started with BPC 157,
Okay.
body protective compound. And that was the first one introduced me to that was Joe Rogan, actually. I was listening to one of his podcasts, and he was talking about BPC. So what is that? Then there was a hype around Liver King and what he was doing and the
Oh my God.
supplements he was doing. Yeah,
I
you should.
watched it. I watched it.
You did
You told me
that?
to watch it and I did. It was
Crazy, huh?
insane. Oh my God.
The crazy part is people actually believe that he was natural. For me,
Yes. I believed I'm so gullible. I'm like, oh wow. And then at the end I was like, okay, Lisa, yeah, you gotta not believe everything you see.
I'm glad you see through this. It's just amazing that people believe it. Like him, Dwayne Johnson. It's just unbelievable. You know, like I go to the gym and I work hard.
Yeah.
It's just impossible to have that mass and this kind
Well,
of
you're in great shape. You do have a
supernatural.
lot of mass, but yeah, I
Yeah,
get it.
but this is
That is unheard
supernatural,
of.
Lisa. This is
I know. I know.
unbelievable. So anyway, so I dive deeper. Then I start getting BPC 157. And after 3 months, the recovery, the cuts, after 2, 3 days, I heal. The gym, I can work whatever or how hard I can. And I push myself. Sure enough, 24 hours, 48 hours, I can go back, work at the same muscle. I start
Wow.
putting muscle mass, start losing fat. It was just a life-changing experience. I said, okay, it doesn't stop
Jeez.
there. Let me look into something else. I looked at something called MK677, which works as a growth hormone supplement. So it acts on the glands to push, similar to growth hormone and function similarly. But the hunger, I could open the fridge and wouldn't get my head out until everything is done. Midnight snacks, day snacks, snacks between snacks. It was just unbelievable. So I said,
Oh
okay,
my God.
there must be something better. Then I get to TB, thymosin beta 4, right? Which is just amazing. So let me go back a little and tell the listeners what is peptides. Peptides are amino
Yes.
acids. And what
Okay.
are amino acids? Amino acids are the building blocks of protein. So our body contains water, proteins, which is muscles and muscle fibers, and we have carbs and we have fat. Proteins are a sophisticated type of amino acid, usually more than 50 amino acids connected together to form the muscle fiber. So these amino acids are connected together by a peptide chain, right? Which is the glue that glue together. So what if it's less than 50 amino acids? We call this peptide. For peptides anywhere from 2 to 50. And this is the FDA classification of peptide, 50. From 2 to 50. All right. So what are peptides? What exactly they will do in our system, right? They discovered that we do have peptides in our body. We have almost 300,000 peptides in our body. We discovered 35,000. So we didn't even scratch the surface.
Wow.
Some of the peptides are hormones, like growth hormone, that's a peptide. Insulin is a peptide, right? So we do have peptides in our system. They act like hormones, but the best part is they act as signaling cells. So when we take peptide, which is chains of amino acid, and I will mention in a second how we discovered that. We take them, they signal to our system, would you mind please go get all the growth factors to heal this injury, or form collagen, or regenerate some of the damaged cell. So they signal to them. These are the messenger that will tell the body or the enzymes or the hormones, please focus on this injured area. How did we discover this? A scientist more than 50 years ago looked at rats, and while they're eating, he noticed that they secrete a lot of peptides in their stomach. So
Okay.
he actually did the experiment by putting a tube in their stomach to extract this, studied the peptide, and this is where all started. From the gastric juice, the first peptide was formed. So it's
Wow.
as natural as it gets, right? And as potent as it gets. In my opinion, people are taking steroids and performance enhancing drugs, right? They should look into peptides because they are the natural way of performance enhancing of all our function. They discovered there are peptides for healing, like I said, like BPC 157, TB 500, or thymosin beta 4. And there is a new one, it's called GHK copper, which the listeners would love that. It's the natural Botox.
Ah,
Yeah, so
there's the anti-aging stuff.
reform, yeah, it's reform collagen. It stretch the skin, remove the wrinkles, and give the youthful look again without having Botox.
Wow.
Yeah, I've seen hair restoration clinics in Dubai. I was following them, and they start injecting that in the scalp with PRP for hair loss because it enhanced the scalp to form or slow down on the hair loss.
That's exciting because I see like a lot of people, they get addicted to Botox and then they end up looking really strange.
It
Like
is.
it's not real. It's not your body. It's not authentic. It's not you. So this gets me excited because it's like the natural enhancement of yourself. It's the chemicals that the body needs. So it's not fake. It's not whatever the stuff they put in the body is to make those body parts. Oh my God, what's it called? All the things, but it's real. And
It is.
that's amazing. Oh my God. Now I know why you're so obsessed. Okay, I get it. I get it.
It is super exciting. I had this discussion with one of my patients this week. So she came in, I haven't seen her for a while, and they said, "Did you lose weight?" I said, "No, I'm just getting old." I said, "What do you mean?" I said, old people lose muscles, lose bones. I said, "Okay." And I decided not to do anything about it, and I'm gonna accept it and age gracefully. So anyway, after we finished our treatment, I said, "Let me tell you something. All right.
Yeah. You're like,
I
shh, nope,
understand.
that's yeah.
Yeah, you know what? I understand. I understand there is a wave that people that like women wouldn't dye their hair, wouldn't do fillers and try to age um naturally, which is I'm absolutely with this. But what about function? I said, I totally agree with you. You don't need to do both. You don't need to do fillers, right? You don't need to do a facelift, right? But when we age, our bones get thin, or the facial bones actually thin, the muscles thin, and we lose our facial muscles, and the skin thin because we're not producing collagen, right? So that is very common. And if you get scratched, if you scratch yourself with your fingers, you can bleed. Do you really want to live like that? You want to really live that your skin is so thin you cannot sit 10 minutes in the sun, right? And you'd end up with skin cancer. So she thought about it and said, "Yeah, you're right." I said, "I'm not telling you just beautify because you're pretty the way you are. And all of us, no matter what, this is how we look, and we should really accept it, right? But the function is a big thing, right? If you find that your collagen and your gums are thinning and you're losing your teeth, why do you need to live like that, right? I always thought, you know what I mean? Like we're young, we get old, we get to the peak of our adulthood where we're really healthy and we have golden years and whatnot, and then we decline. What if we can find something that we don't decline? We live the same way for as long as we can. I'm not saying that we're going to be immortal. I'm not looking to be immortal, but I want to live till whatever age and just cease to exist. I'll be able to go play with my kids, grandkids, go fishing, go camping, hiking, boating, car racing, whatever I'd like to do,
Yeah.
right? And then one day, I'm just not going to wake up. Why do I have to struggle every morning to get out of bed? my knees hurts, cannot sit in a sports car, cannot sit for too long, cannot even go to the second floor in my house, or it shouldn't be this way, right? So if
Yeah.
peptides the future, which I truly believe it's the future, right? And it's the answer for a lot of questions that medicine doesn't have an answer to, right? And what's
Well,
exciting, yeah, what's exciting, Lisa, that I had a meeting, I had a conference a few weeks ago in Miami, and they are treating MS. I had a close relationship with MS. We have one family member that she has MS, and all what we can do is a needle every month to slow her MS, right? Imagine if we can reverse that with Peptide, which they are doing,
crazy.
right? Imagine if we slow.
Absolutely crazy. That would change so many people's lives. And I just want to say quickly that that patient that came in to tell you that she was happy to age gracefully, a lot of people say that just because they don't know. They don't know what is possible. So by you spreading the word, by you working with her, by you giving her the information that, hey, actually, you can improve your quality of life by doing this. You completely. So I think people say that because they feel like they don't have another choice.
Yep.
But to have another choice, like it's like I'm excited, like just you talking about it. So back to MS. So that would change so many people's lives.
They will, and it's not only people. People are scared because they've seen and heard horror stories from celebrities.
True. Yep.
They've overdone it
Yep.
so much. I had 70 years old lady, and she came to me as a patient and whatnot, and they said, "Okay, you've got migraines. Let's try Botox." She refused Botox
Okay.
as if I'm gonna poison her. So they just sat down and said, "Tell me why. I don't want to look like celebrity. This is totally different. You're not gonna look with big cheeks and big lips and whatever. Botox is different, right?
Yeah.
And when we do it for migraine, it's totally different when we do it for cosmetic reasons, right?
Yeah.
So she finally accepted and she's happy with no migraine. So I think the celebrity world scared a lot of people from doing anything to their face or their health. Is
Yeah.
overdone,
Yeah.
unfortunately. Right?
Way overdone. Way overdone.
Yeah, they are the ones that abused Ozempic, GLP-1, and started with the Ozempic pills, right? Uh, Ozempic is a great medicine, and it is the most famous, most popular peptide on earth now. The company made a killing out of the GLP-1 Ozempic, right? And it's just a peptide that works specifically on appetite, but it's also help lose weight in different ways. But in smaller dose, it's such a weapon in a good way. It's
Yeah.
it's it's the only medication that can clear fatty liver.
Oh wow.
Yeah. And we all have fatty liver. I don't care how much body fat people have, even if it's in the single digits, we still have a small layer of fat around the liver. It's just the way it is. Liver is so greedy, and they will keep a little bit of energy source, right, around it, which is the fatty liver, which it can end up with liver cancer and other stuff. So it's the only medicine. They discovered that it can clear bad cholesterol. Now,
Wow.
it levels the insulin. It actually helps with the insulin resistance when you get older and the glucose sensitivity. So this ups and downs when we eat in small dose. We're not talking about the celebrity overdose. A small dose, right? It keeps this fluctuation from not happening. We eat, food comes in, sugar and carbs get in our system, spike, and then a few hours later goes down. It prevents that, which prevent inflammation as well. So it is a strong anti-inflammatory as well, right?
Wow.
Yeah. So Peptides are just amazing the way they are. But again, it has to be used under the supervision of the medical professional who understand how and when they should be used.
Yeah, exactly. So let's talk about that a little bit. What about this, the dosing and like how is it used?
Okay, so let me divide the peptides as they currently um, working.
Okay.
And the research in peptide is so fast, so this information could be obsolete in 6 months. But this is what we
Oh,
know
wow.
now, right?
Okay.
I'm going to start with anti-inflammatory and regenerative medicine and longevity. Those
Okay.
are mainly the Wolverine stack, TB 500 and BPC 157. So BPC is more localized. We can take it by pill, 500 milligram twice a day. It has to be twice a day because it's short acting. So if you take it once a day, you're probably at nighttime, you're not getting the benefit. So what it does, it goes specifically to the injured area. So it goes in the stomach first, and it actually helps with gastric problems. So anybody has um, gastric motility problems, slow stomach like diabetics or whatever, gastroparesis, anybody has indigestion, anybody has whatever they have in the stomach, it helps significantly, right? It actually helps with acidity as well. So that's number one. And then it goes in the bloodstream and it signals to all the growth factors to go to the injured area, whatever injured at this time, right? You twisted your ankle, you have a little bit of arthritis in the knee, your back is hurting now. It goes in and call all the growth factors to come in and fix this problem, right?
Wow.
Some specialists, some anti-aging regenerative, would like to get a little bit closer. So they say, do it sub-Q, under the skin. So it's taken 500 microgram under the skin. It's a vial that comes with a dry powder, and then we mix it with 1 cc of sterile water, and we take a little bit over the course of 2 weeks from it. So, and each dose is different. Sorry, each pharmacy is different, but you do it subcutaneous under the skin, very close to the injured area. So if the ankle, try to put it closer to the ankle. In my
Mm.
opinion, this is the safest way you gotta do it at home. But when you go to a clinic, like what we do in our clinics, we go with ultrasound, see where the tear, and we inject it.
Okay.
Unfortunately, this kind of resource or skill is not available everywhere. So it's acceptable to inject it very close to the injured area. So even Joe Rogan was talking that he had a crushed spine or whatever, and they injected him in his back. The recommended way of using this is you do it once a week in the injured area or close to the injured area for 3 to 4 weeks. Then you continue on pills or maintenance for 90 days.
Okay.
This is for injuries. What about
Okay.
longevity? I've been doing it for the past 5 years, once in the morning, once at night, pill form, and I've never felt any better in my life. My skin is better. Recovery is amazing. I got any cuts, any injuries. Um, I hurt myself at the gym within 48 hours. I twist my ankle, my knee, whatever. It's just amazing. So it's more
Wow.
localized to that. I think increase the growth factors in there. Thymosin beta 4 or TB 500 is a little bit different because it works globally. So it increased the circulation to this area. It increased the formation of blood vessels in this area, right? So it's an injured area, whether it's a ligament. Ligaments, unfortunately, have got poor blood flow. So it will form blood vessels to get the growth factors towards the injured area. But it also helps DNA recovery. So if somebody has got DNA problem in this area and it start to build arthritis or inflammation, it will stop the inflammation because it's a strong anti-inflammatory, and it will help with arthritis and fixing the DNA. So it's more global, so it works in the rest of the body, while BPC is more localized to the injured area.
Okay.
The other one, which is quite amazing, is the collagen and the aesthetic one. And I know our listeners would love that because it's the new natural beauty fountain of youth. So
Fountain of youth.
yeah. So two actually are very important, right? Number one is the GHK copper, which is a peptide, but it has copper. So it increase copper, but also increase collagen formation significantly. And plus the skin rejuvenation. It helps with hair loss. It helps with facial hair, so lashes grows back, eyebrows get thickened. It is quite significant. But again,
Wow.
problem is it has copper. It has to be used very carefully. So I would suggest to use it as a cream, ointment, or serum on the skin. Or you can use it pill or subcutaneous as well, but use it for a month and stop for a month. So it wouldn't end up with copper toxicity.
Okay.
That's why I advise just follow up with somebody that just understand, you know what I mean? So you wouldn't end up with a copper toxicity, which could end up with a liver problem. So at least know that. But the other one is CGC 1295, which is precursor to growth hormone, right? So CGC and ipamorelin are growth hormone releasing peptide and growth hormone releasing hormone. So it increases the growth hormone, which we can check by checking blood, doing blood work and checking something called IGF-1, right? It's secreted by the liver and we goes in the blood, so we can check how much we need of those. And again, we do it in a cycle, so 6 to 8 weeks, and then we stop. It's done sub-Q, but it help with skin loss, fat loss, skin rejuvenation, collagen, muscle mass, and it helps with the facial. We call it. It gives this useful features like the recent surgery of what's her name, Kris Jenner,
Okay. Okay.
right? I'm 100% sure that she did surgery, of course, but the quality of the skin, the quality of the skin is just unbelievable.
Yeah, she's glowing, essentially.
Yeah, the quality of the skin, she must have used peptide. Somebody really smart.
Wow. So
Yeah.
is all of this like prescription grade? Is that how can people get a hold of peptides like
So
in
people
all
can
of
get a
these
hold of,
forms?
yeah, people can get a hold of peptide. There are pharmacies that
Okay.
actually you can access them in the US and they will send everywhere in the world. They just
Okay.
need a prescription. So a doctor will give you a prescription, will do the blood work, genetic testing, hopefully, and then he will write a prescription with the dose, and they will ship it anywhere in the world, Canada, Europe, Middle East, anywhere, which is quite amazing, right? We'll show you how to reconstitute this, and you start doing it. Was quite amazing because it gives access to really natural supplements and makes you get your faith back into the human body. So we actually can defy aging. We can actually live a better quality of life. And aging is not a part of aging. It's not a part of getting old, like the old narrative. I just start now to just be irritated of this. No, you don't. And getting old doesn't mean that we deteriorate and suffer, right? That's something that if I can just educate, not even treat, just educate as many people as I can, I think I've made a difference. right?
Oh my God, 100%. Yes.
Yeah. So go back to more serious indication for peptides, which is just as exciting. They're treating dementia and Alzheimer now, right? Which we never had answers to that. We can slow them down through medication, but we'll never be able to reverse them. So there are peptides now under study called revolutionize, and it actually connect the neurons together, right? Our
Okay.
problem that anything can be connected, bones, if it's broken, will be connected, muscle, if we sew it together, like rotator cuff, it will be connected back, right? Skin, we sew it, a couple of stitches and it goes. Nerves won't grow back. And that was the
Oh,
painful
right.
part. Once somebody has a severed nerve, we're done, right?
Wow.
Cerebral and
Yeah.
the nerves together again.
Jeez.
Yeah, it will signal to the nerves to grow back, right? Which help the brain neurons reconnect again, and it will help us treat Alzheimer, dementia. So it just unbelievable powers.
Like I said, now I know why you're obsessed.
It's everything comes out through this research, Lisa. It's just unbelievable, unbelievable. And
Wow.
I said, yeah, I think that my patient, I can prescribe that. This patient, I'm gonna call them to advise them about this research, or I can enroll. Already enrolled probably like 5 to 10 patients so far in an MS study in Orlando to reverse MS and treat
Wow.
MS. Yeah,
That
just
must
with
feel so
peptides.
good.
Yeah, just with peptides.
Jeez. That's
Yeah,
craziness.
it is. It is. The most recent study, and I'm looking into it cautiously, is the one for cancer. I don't want to mess with cancer, but there are
Mhm.
studies that peptide can prolong the life and slow down cancer significantly. Right? I wouldn't
Jeez.
advise patients to stop their chemotherapy or radiation or whatever. I don't want to give anybody hope yet, but maybe in the next few years, maybe 6 months from now, we'll be talking, and I will tell you that they achieved that.
Jeez. That's exciting.
It is. It is. Especially we see a lot of cancers coming in young age now and taking a lot of young lives. It's so sad, but I'm telling you, there is a hope. And in the next few years, um, we might have answers. And by the way, my excitement and obsession for peptides is becoming contagious. Like I start to train some of my staff members, and on their own now they're bringing research. Have you read that? Have you looked into this? We really think this is the future of medicine. I said, I know. I know maybe in 5 years, we wouldn't need to treat pain because we just can prescribe peptides and the patient will be pain free. It's all possible with this. So it's not only anti-aging, we're not going to be immortal again, but we can live healthy to the last minute.
Oh my God. I have like just chills and just so exciting. Where can our listeners go for information from you? Do you have resources on your website? How can people get in touch with you about this?
They can um, DM me on my Instagram, Dr. Hany Demian or Hany Demian MD, Facebook, LinkedIn. I'm always active on LinkedIn, publishing and sending a lot of information about peptides. My website, we are updating our website now with all the podcasts, all the information about peptides. We're actually starting the first study of its kind, and it's going to be one of the largest about peptides, anti-aging, and pain management in Canada.
Oh,
We are
wow.
in the yeah. We published 2 papers. I'm going to put them on the website and Instagram very shortly. I think I put it one of them on LinkedIn already, and my website is drdamian.com. And I encourage people to ask. I encourage people to challenge, send questions. Um, happy to go on the phone or an email. I'll send them the email if we have any questions. And if I don't know, I will direct them where to go. But I love challenging cases. I'm obsessed with peptides and giving our body a chance to heal itself. I never thought it was possible. When patient comes to me and said, "Oh, the body healed itself," that was 5 years ago. I said, "Yeah, sure. Can I try
Right.
this or the medicine?" I said, "Yeah, you can try whatever. Is it gonna work? Probably not." That was my answer.
Yeah.
Now it will work. It will work, and I love it when the patient said, "I tried everything with you. I'm looking now on peptide." I said, "Go for it."
Yeah. It's, oh my God, that's amazing.
Yeah, it just a great feeling. And when the patient said, "I read about or heard you talking about peptides," I got I got chills. I have this excitement in it. Oh, tell me, what did you find? Because we're all learning, Lisa, and we're all gonna keep learning about peptides. I take it, I tried it on myself, right? I injected all my torn muscles, ligaments, and everywhere that it hurt just to try it. I will tell the patients what worked for me, what did it didn't work for me. So you have somebody that actually trying it with a medical knowledge, not a fitness influencer, a medical
Yes.
knowledge, right? So we can sit and talk science. Um, I'll be very happy if anybody will reach out and have a question or a challenge.
Amazing. Oh my God. Do you have any last minute thoughts before we wrap up today? I will say this, just so you guys know, Dr. Damien and I are in conversation about me coming to see him, and we plan to document that, but it's in the works, so we're not telling too much stuff. But I'm beyond excited because this man is so genuine, and he truly, you can feel his heart. So honestly, reach out to him because he can answer your questions. But just be patient because he's busy.
But this is a passion, Lisa. The last minute advice: you don't have to live in pain. It doesn't mean that we're getting old or you're getting old or anybody's getting old that you have to suffer. There are ways not to suffer. Arthritis, back pain, joint pain is not part of aging. This is your choice, right? And as I always say, if you're not changing it, you're choosing it. You don't choose pain.
Powerful. That is a mic drop at the end. Don't choose pain. I love it. You guys, there is a solution. You don't have to suffer. You just heard from Dr. Damien talking about the future of medicine and what options we have. And that gets me excited about the future. And it gets me excited about longevity because we all want to live, but we all want to really live long, fulfilling lives. So sounds like this is going to allow us to do that.
Absolutely.
Thank you so much for being here. Like I said, I'm happy you have your voice back because that was amazing.
Thank you. I really appreciate it. Thanks for having me,
So
Lisa.
amazing. And to our listeners, thank you for being here. Do not forget to like and subscribe. And we'll make sure to have Dr. Damien's links in the show notes. And I'll be blasting this all over as well. So stay tuned. And I can't wait to see you guys again. Until next time, I'm Lisa Urbanski with The Advisor. And you just heard from Dr. Damien. Have a good weekend, everyone.